Welcome back. We do apologize that traffic is slightly delayed, but however, we'll be bringing you traffic update live from the streets here in the nation's capital. Now, Namibia faced two outbreaks of cholera in 2025. The first registered case was in the Kunene region in August 2025, and the second outbreak was in Grootfontein district, which was declared in November 2025. Now, this year, on the 12th of January, the ministry recorded 99 suspected cases in Grootfontein. Of those, 99 that are suspected and 32 are confirmed cholera cases. Now, to shed more light, so we're joined by Walters Kamaya, the Public Relations Officer at the Ministry of Health and Social Services. Mr. Walters Kamaya, compliments for the year, and thank you so much for making time to speak to us this morning.
Likewise to you, Mr. Lord. Season's greetings to you and the listeners.
Okay. Let's briefly get to update the viewers on the update with regards to the reported cases in the Cholera region, specifically within Grootfontein. What is the status currently as we speak?
Yes, as we all know that the Minister of Health and Social Services has declared cholera outbreak in Grootfontein district in the Oshozonjupa region on the 27th of November last year. As of the 20th of January 2026, we have recorded 108 suspected cases with 39 confirmed cases. No suspected case was reported during the last 4 consecutive days. That means that the cases are not increasing. It is also worth noting that no death has been recorded since the outbreak. This could be attributed to the early health-seeking behaviors of the community down there and the surrounding. We want also to thank and encourage the community members to continue reporting timely to the health facilities when they are not feeling well.
Now, we understand currently that the outbreak remains small with about 0 to 2 cases reported daily, but the transmission appears still to be going, although it is not increasing as you indicated. Let's talk about how the ministry is fighting this outbreak.
Yes, the ministry have activated the incident management system, which is an approach that the ministry has adopted in managing the public health emergencies. The incident management system brings together a multi-sectoral and multidisciplinary experts to coordinate emergency management and efforts in a structured and efficient manner. The IMS is not only based on a national level, but a regional level as well. So I must also say that the ministry is responding, or it has teams that is on the ground, and this comprises of the cadres from different sectors such as Office of the Prime Minister, the Minister of Agriculture, Fisheries, Water and Land Reform, Minister of Urban and Rural Development, Minister of Finance and Public Enterprise, Minister of Defense and Veteran Affairs, Minister of Education, just to mention a few. The health development partners are also actively into this to confine this. We speak about partners like WHO, UNICEF, US CDC, Africa CDC, and others that are working together with the ministry.
Now, Kamaya, we know that this outbreak is driven by challenges with regards to water, sanitation, and hygiene. How is the ministry working, especially with partners to provide safe water, improve sanitation, and manage waste removal that could also possibly escalate those suspected numbers?
Yes, as I've just indicated, cholera control does not depend on the efforts of the ministry alone, but cholera prevention and control relies primarily on the combination of safe water, sanitation, and hygiene. Among the stakeholders that I've mentioned the Minister of Agriculture, the one that are responsible for rural water supply as well as sanitation. I also mentioned about MURD, which is coordinating with the ministry and local authorities to ensure that water supply and good sanitation are exercised there. For this reason, we had been engaging and collaborating and collaboratively working with relevant stakeholders to address the issue, especially when it comes to water, sanitation, and hygiene. With stakeholders like the municipality of Grootfontein and other ministries, we are hands-on on the issue, and we are operating at full scale to see to it that we give what is necessary.
Now, with schools just having reopened, how will the ministry ensure that the cases of cholera in Grootfontein will not increase, and that especially the fact that children who will be attending school are safe? I think we also saw that the regional director of education within the Uchenjupa region indicating that he's directing all schools to come back to the process of hand hygiene, washing hands on a daily basis. Is this part of the coordinated effort that you are also talking about?
True. And we, just like the elderly and pregnant women, children are also most vulnerable groups in the community. Therefore, the safeguarding of the health and protecting them from preventable diseases is very important. To realize this, we are working with the Minister of Education, and then all schools are being reminded to ensure that hygiene practices such as hand washing is very important. The reason we are emphasizing on hand washing is that you know that most of the diseases that are coming or are affecting us, they come through our hands because of touching of surfaces, touching of a lot of things, shaking of hands, including even our food that we eat. Especially when it comes to fruits, you'll find that when you go to an open market, before or when you want to buy a fruit, you will not just pick that one, but you will touch 3, 4, 5 before you pick the last one of your choice.
Now let's talk about the common symptoms of cholera and when one should seek medical care if they suspect that the children might have contracted, for instance, cholera.
Cholera can cause a severe acute watery diarrhea, which can be fatal within hours. If untreated, most people infected with the cholera do not develop symptoms but can spread the bacteria through their faces for 1 to 10 days, and symptoms appear within 12 hours to 5 days after infection. Most people with the disease have mild or moderate symptoms. A majority of patients develop severe acute watery diarrhea and life-threatening dehydration. I must mention that early treatment is very important in saving life. Therefore, we implore the public to seek health care immediately when they experience some of the symptoms that I have just mentioned now.
Why do you think there is a need to increase, the increase of cholera there is an increase in cholera cases, especially in the Grootfontein district? What are some of those, maybe areas of concern that you're seeing that you really think that needs intervention immediately and might be leading up to the increase in numbers? Because we're talking about 99 suspected cases beginning of the week, and now you are confirming that there's 108 suspected cases.
It's on a contrary, cholera outbreak in Grootfontein is under control, I must say, and the cases had been coming here and there. Looking that this outbreak started in November last year with the number of cases recorded. One can really say the situation is under control. In fact, for the last 4 days, not even one suspected case has been recorded. So if there are no new cases that are being recorded, we are saying that we don't want to say we have arrived, but we want to say our efforts are being realized. Of course, we are not putting our guards we are not putting our guards down. Rather, we are strengthening our collaboration with the relevant stakeholders to bring this outbreak down. When we speak about 4 consecutive days without recording any suspected case or any confirmed case, for us, that it's a message that sends or that says that we are getting there, but we don't want to give ourselves credit to say we have arrived, but we still want to say let us strengthen the system.
Okay. What are some of the precautions that one should take, especially when you're traveling to the Grootfontein district? What should one do?
Well, one should know that cholera is a bacterial disease that spreads primarily through contaminated water and food and causes severe diarrhea and dehydration if untreated. Therefore, drinking of safe water, one should be mindful of that. It's very important. This could be boiled water or treated water is also safe. Avoid ice in drinks unless one is sure that they are prepared with safe water. Eat well-cooked hot food and wash fruits, vegetables with safe water. We want to emphasize that this cholera is an issue of hygiene. let us just see to it that our hygiene is up to standard.
Now, as we begin to wrap up our conversation, let's talk about how government sectors, NGOs and community leaders and the media can work together to address this outbreak. Is there more that they can still be able to do to be able to support the ministry?
Indeed. As a country, we need to put our efforts together, being the government sector, NGOs and civil society, private sector, community leaders, traditional leaders, religious leaders, individuals and community at large. Let's do our part in addressing this cholera outbreak so that we contain it and stop it to spread to other areas of the country. I want to say that each one of us should have a part to play in our different areas. We should be able to find something that we can do to strengthen to see to it that cholera does not spread further.
Well, Walter Kamaya, thank you so much for making time to speak to us this morning, and we wish you all the best in containing the situation that is in the district of Grootfontein.
Thank you. My pleasure for having me.